right, so I have here Dr. Todd Frisch, and I'm so glad that you have agreed to join us and share a little bit about your expertise. You've been in the field a long time. You're just sharing with me that you've been lecturing on this stuff for over 35 years. So I love having people with so much history and expertise in the field, and I'm sure my followers are going to learn a lot. So thank you so much for being here.
It is great, and some older, heavily. I
Well,
guess,
it comes with experience, right?
yeah. I wish I'd like to reverse it back, keep everything that's in my head, and go back to age
Right.
28 when I'm started. But they don't let me do that. So,
Yeah, yeah.
but I did love the journey. Still am on the journey.
Yes. Well, actually, let's start there of you just sharing a little bit about your background because I have the impression that your career has shifted a lot over the years. And so I'm really curious about what were kind of some defining moments for you that brought you into more of the holistic side of the
Sure,
field.
sure. So, never knew I was going to become a doctor. Was kind of a weird turn of events. Ended up living in central Wisconsin and dropped out of college three times. My kids point that out often. I dropped all the straight A's. There was a difference. Just couldn't find my way in life. And this chiropractor moves across the street from me. Mike Weir was his name, just a great guy. And in a kind of low time in my life, he said, where are you going to be in 6 years? In those days, it was chiropractic was 4 years, and then the pre-med was 2 years. Now it's 4 and 4. But it just hit me to the core. And I thought, I had no idea. He said, well, have you considered becoming a chiropractor? And I go, no. And I walked across the street from his house. He lived just down the block, and I built a fire, and I decided right then, and I did, and the rest they say is history. That from that point on, I just had a passion to learn everything. I just never
Mm,
was never prejudicial in anything. But I bought into whatever they were selling, and I thought this is good. I'll take a look at it. So I got through school. I was heading to northern Wisconsin to practice. I had a building. I was just about to sign the lease, and the president of Logan College flew up to see me in Davenport, asked me to come to St. Louis. So I went there for 2 years, and that was 4 years later. I was still there. He went on and moved on, but I stayed there, and I just had this desire to help sick people get well. And in the beginning,
yeah.
I was a quack, and I didn't like that. I didn't like the label, but I was helping people, and I just kind of let it go. And then as medicine began to accept the fact that we're not going to go away, we became alternative doctors. And it's been
Right.
interesting to go through these words. And
Yeah.
then still wouldn't go away. I didn't like alternative because it means I choose this or I choose this. We then
Right.
moved into complementary medicine after alternative
Mm,
medicine. So now we complement the great and wonderful Oz, pun intended there. Uh, and then we all went to CAM seminars, complementary and alternative medicine. And they thought, well, you're not going to go away. There might be some benefit. And they integrated us. And then we all practiced integrative medicine. Today, we're practicing functional medicine. Does that not sound like a math problem to you, Jen? I think
it does. I'm trying to figure out how to categorize you. Yeah. And
yeah.
make you fit
So
in.
I have two things I want to happen before I leave this earthly plane. And I'm close to the end and the beginning, which I'm okay with. I have no fear of dying. I just don't want to be first in line. I have some things I still want to accomplish. And one of them is I want to change functional medicine to restorative medicine. We need to call what we do as restorative medicine. Let's restore people back to a place they should have never left in the first place. So
Yeah.
I want to see that happen. I think it will happen. I just think I think it's time for another change. I don't think there'll be anything after restorative because I think it's the best word for what we actually do. I have nothing
Yeah.
against Western medicine. I referred out patients every day for things that were needed medical care, but
Yeah.
so many things didn't have to happen. I heard a line once that says, "You can't measure what you prevent." And Jen, you and I, we've done this. I've obviously done it longer than you, but we can't measure what we've prevented. There's no way to do it. And yet, deep in our core and our heart that we've made such a difference. So that's point number one that I want to see change. The second thing I want to change is a huge paradigm shift. This is going to take some time, but I think it's going to happen. As physicians, I was trained with a what's wrong mentality. And that's what medicine does. They're all about what's wrong. The problem I ran into is I had that patient, usually a female, chronic fatigue syndrome, fibromyalgia. She had anxiety, depression. She had irritable bowel syndrome. Doctor, what does that mean? That means your bowels are irritable. Well, what a diagnostic clue that was to what's going on. What a bizarre term. She had weird rashes and she had insomnia, and everything was textbook midline normal. And so the answer medically is 20 milligrams of Prozac. Now you don't give a crap, but you feel like crap, which I didn't feel was a therapeutic objective I was comfortable with. And that was the medical approach. And again, I'm not slamming medicine because what are you going to do? Nothing's wrong. Therefore, it must be in your head. Let's try some SSRIs. So Prozac was the drug of the day for a while. So the shift needs to happen, this paradigm shift from a what's wrong mentality, asking what's not right. It sounds like semantics, but it's a door that needs to open. And when I made that shift, my life just changed forever. I never saw what eventually came. I never saw it coming. And there was nothing in the medical world that could tell us what's not right. And again, you got to be in my world, you got to be 2/3 sick before the medical says show anything wrong. So I hit the books. And I studied everything. I studied Ayurvedic medicine. I studied astrology. I studied anything I could put my hands on. I got really deep into traditional Chinese medicine simply because I could find so much data on that I could study. There was a lot of books. When I looked, 30 years ago, there was one book on Ayurvedic medicine. I think Ayurvedic medicine is fascinating with the three doshas and the way they look at the body. But there just wasn't a lot of data. And I loved books. And I got into traditional Chinese medicine. I bought a book in the early 80s called Secrets of the Face. Fascinating book, very poorly written. The author has passed away, so I can say that needed an editor badly. Yeah, but there were 9 face shapes in this gal's world. And I've got over 80 books on facial diagnosis. And this book was about reading the face. And I became totally enamored with it. And as the years progressed and I saw more and more patients, I just realized I was using this facial diagnosis. I spent a few years being macrobiotic, very bizarre, and just a weird way of eating. But I thought it was the right way, and I made all my patients go macrobiotic, and I became very hyper aggressive and you got to eat this would be wrong. And I found myself being really critical of everything and everybody. And I realized I don't want my brain to work that way. So I kind of abandoned. But they had some facial diagnosis on there from a physiological standpoint. Yeah. So the combination of this book I found in the early 80s and my little dabble into macrobiotics ended up allowing me and my daughter to write a book called WTF, Does Not Sell Well at Church Books.
Right here. Well, yeah.
There you go. A practical guide to understanding health and personality through facial diagnosis. And so I just, it just took off. About 15 years ago, my wife came to me, kind of lost her mind and got in my face and said, "You help everybody, but you're not helping me." And I go, "Well, there's nothing wrong with you." And she goes, "I can't lose weight." She was in menopause and I said all the right things from the husband standpoint. "You're beautiful. I love you. Real out of didn't matter. It's how those blue jeans fit." And this is a very intelligent woman, but it's how those blue jeans fit. So now she made me look at diet. And I like diet. I just don't like diets. And because the miserable way of doing life. And it's just, there's always a diet book on the top seller in the New York Times bestseller list. And they all suck. But now it's my wife, and I had to take a different approach. So I dug deep into dieting, and I found 2 things. I ended up building a company called Shape Reclaimed, and it's a homeopathic formula sitting right here, this little guy right there where the camera.
Yeah.
And I build Shape on 2 premises. Number 1, all diets fail because all diets fail. Number 2, it can't be metabolic. I mean, obviously thyroid would be an exception there. And then I began looking at and asking questions, why do all diets fail? And it was just a fascinating walk into the world of science because I was looking for scientific reasons why all diets failed. And the interesting I noticed, take Atkins diet. You take the 240-pound construction worker, he goes on Atkins, goes into large ketosis every day, and he just crushes it. And 4 months later, he's 200 pounds, feels better than he ever has, until he does what? Until he eats a piece of bread. That's
Hmm.
was nuts. His brain says, "Feed me, Seymour. I want carbohydrates. I want it right now." So what happened? He went from 240 to 200, ate a piece of bread. His brain took off, and now within 3 months he's at 240. 2 months later he's at 260. I read a book in the early 80s. Again, that's how old I am. um, it was called "How to Lower Your Fat Thermostat" by a main picture. And they were the first to bring to my mind the theory of what's called a set point. This is
Mm.
what your brain thinks you should weigh.
Right.
And I thought, wow, this could be the clue. Perhaps our problem with weight is not metabolic, but it's a brain problem. So I built Shape on
Mm.
it, and it was nothing short of remarkable. So I built a homeopathic formula with all these things to support brain function. And we do an anti-inflammatory, somewhat calorie restricted diet, although I hate counting calories. But and we use a simple urine specimen, not starvation. All diets fail because the brain gets a message that it's starving. I don't care what program you're on. Eventually, the brain says, "I'm starving," and you can lose the weight until you stop, and then you start eating, and boom, you come back, and then it's the and then some, and then that and then some. Say that 10 times. Is what made this so alive to me. And I realized if I can have people shed toxic weight, never let the brain go into starvation, I was onto something. Well, I now have a national company. We have 600+ doctors, practitioners across the nation using this program. So my practice just evolved
Yeah.
as, as we went through all the changes and the stuff I read. So in my world, there are 9 face shapes, and this is what they look like. And
Okay.
I'm this guy right here. I'm a bucket face, and you are somewhat a bucket face too, Jim. So we bucket faces. We love to put things in our bucket. We love to learn. There's no book on earth that we shouldn't personally open. We need nothing. We don't need TV. We don't need music. We need a chair and our brain, and we can just enjoy ourselves all day thinking. And our spouse will come
Yep.
by and say, "What do you think about?" And I go, "Oh, nothing." "You got to think about something. You can't just think about nothing." Well, actually, you can. It's my favorite part of my brain is when I think about anything. So we're intellectually persistent. We're thought leaders. We're list makers. We never finish our lists. It's just God will take us home if we do. It just
Yeah.
it's possible. And I remember I grew up in the Mercedes 80s professionally, so it was all about money and how much you made and this kind of stuff. And we affectionately or unaffectionately call it the Mercedes 80s. And I remember it was all about goal setting in those days, and there was Nightingale Conant and all the books you could buy. And I remember setting a goal on a certain amount of money that I wanted to value. And it was December 15th. I'll never forget it. And that I realized next Monday's collections will put me over the top of this thing. I made this goal I had for it was just an unbelievable amount of money. And I sat there and go, well, now what? It gave me that I'll be happy when kind of energy. And I thought, why am I not happy right now? And I realized the unnecessary nature of goal setting for me as a bucket. We bucket faces, we're not about the destination. We love the journey. Once we get there,
Yeah.
we're on board what's next. So when I
Absolutely.
realized that there were these 9 face shapes, it opened up a way that I could talk to each patient in a way that they would hear. And I would use words to you like, "I know you need to think about this, but this is what I want you to think about." And I would pat you on the back while I was telling you this, as I was showing you
Right.
supplement I'd like you to take. I'd pat you on the back because we like pats on the back. We also have a little iron quality. It's kind of more square. This is that strong, stable, stubborn. So you're a strong, stable, stubborn thinker. That is who you are. And every patient that walked through my door, I knew how to talk to them. And it was just, it was a remarkable time in my career. I went from saying, "Do you have this?" to "You have this." And I didn't even realize I got
Mm.
that mission. So then my wife said, "You have to teach this facial diagnosis." I said, "But you do that. It's intuitive. It's just not something I teach." She said, "No, you're going to teach it." I go, my wife is this camp based, and they're very matter of fact. The only gray in their life is that this is right, this is wrong. There's no difference there. So I, I did teach it to a group of shape practitioners, shape holds them every year, um, and and then they wanted more, and then I did a 4 hour talk on it, and then they wanted more. I did a 12 hour talk, and I said we need books. So I ended up writing a book. My daughter did an unbelievable job taking my ADD infused thoughts and put them into some kind of order. Had I written the book, it'd have been 1,800 pages long, and nobody would buy it. They'd use it as a
Right.
pickle read. But she took it to a place where it became very, very usable for not just uh, us healthcare practitioners, but for people in the world. It was just wonderful. I remember Abby saying, "Dad, what do you want this book to be?" And I said, "Well, Dad, Abby, I want this to be a book that will change doctors and how they look at things, but I want the public to really love it also." And she said, "Dad, you realize that's not possible." I said, "You didn't ask me what was possible. You asked me what I wanted." And
Mm,
I think we did it, and
yeah.
it was pretty cool. So it was a
Yeah.
long,
Yeah.
long run for a
No,
short.
that's hearing your story, and I think it just, to me, your story really shows that you have kind of let your experiences with your clients and your practice just lead your journey, right? Instead of having just an idea about like what you think things should be like in terms of how healing works, you've allowed your clients and your experiences and your wife and people in your life to really kind of educate and direct that, and you've just kind of gone with what has actually been the most practically useful for people, and you found that focusing on the negatives around, like, what are the dysfunctions wasn't actually helpful, but you realize that everyone has this like innate strength and it's more about expanding on that. Um, so yeah, I would love you to talk a little bit more. I mean, you talked a little bit about the different face shapes in relation to like personality and how you can talk to people differently according to that. Are there other, I mean, I know there's a lot, but, can you share a few more things about how you use the face, as a
Sure,
diagnostic tool?
sure. Before I go there, I once had a dream.
Yeah.
It's kind of James Earl Jones' voice, 10x. I just called it the voice of God. And
Yeah.
he talked about two words. He talked about information and affirmation. Most of us seek affirmation. We learn more and
Mhm.
more about what we already know a lot about. That's how medicine got splintered and went into, you got the proctologist, you got the orthopedist, and you got the neurologist, and nobody stepped back and said, "There's a human in front of me." That general practitioner was too busy naming and blaming and giving drugs for this problem and giving this recommendation for this problem, and nobody stepped back and just thought, "There's a human in front of me." And so when that dream came to me, I realized I got to seek information. I need to learn more. I have to challenge my belief system. I would go to these conferences and these seminars, and my wife would say, "Why are you going to this? You don't believe any of this stuff." And I said, "I get that, but here's what I'm going to do, and I'm going to go eat it. I'm going to buy everything they're selling, 100%. I'm going to just take it all in as if it's gospel. Then I'm going to step away from that." And I said, all right, if I believe this, what would it do to my belief system? Oh, I'd have to change it. What
Mm,
if I and it allowed me to grow as a physician into someone that
yes.
was not I wasn't prejudiced, and that ended up obviously feeding into this whole thing. I remember I was 12 years old. We were poor, and my mom said, "So I have $20 to spend. You three boys each. You can each have $20. What would you like for Christmas?" And I said, "I'd like the complete works of Sir Arthur Conan Doyle, Sherlock Holmes." And
Yes.
my mom,
Lovely.
"What?" I still have the book. I wish I could bring it here. I
Oh,
became
that's
fascinated.
wonderful.
I became fascinated watching Basil Rathbone and Nigel Bruce was Dr. Watson in this black and white version, and playing this incredible ability to see what no one else saw. And now
Yeah.
I took that energy at age 12, and now I have a book. It's unbelievably been successful. so many people are into it. It's just a remarkable thing. So again, the personality is wonderful. I got to have over 80 books on that basic deal on personality, but I want something that had to do with physiology. So
Yeah.
my macrobiotic world, there was this listing face mapping face.
Yes.
Second, let me see if I
Yes, and with the book, you get this wonderful laminated. Yep, I got have this one out.
there you go.
Yeah, it's very
So
useful. Yeah.
every lump and bump and line in the color on the face means something. We call it a marking. And so if I could just, if you're okay, tell me that I can't do this.
Please, yes, I would love it.
Okay, you have a little bit of a line between your eyebrows, okay? And it's a little deeper and slants a little more to the left. So this is the liver. Women, the emotion of the liver is anger. So in traditional Chinese medicine, you have these 5 elements, and all that data was so important for me to understand what's not right. So when you have this liver line, and it's more on my side, it's probably an inherited trait from your father's side. Any alcoholism, father's side of the family they should wear out?
They're Irish, so probably.
Enough said. There is a little bit on the left also, but it's
Yeah.
more pronounced on the right. So now, if I took that information and you had one-sided headaches, and you talk loud with your hands a lot, and then you had kind of a bite to your language, I know you have excess liver energy, and I'm going to support your liver because the number one complaint of someone that's got a liver problem is headaches. It also governs muscle, so a lot of muscle spasms, muscle cramps, and they'll complain of tension up between their shoulder blades. This is a classic wood element imbalance. So I would take what I see on the face, take your history, take my exam, take your blood test, and I would come up with oh, you have a problem here, here, and here. This is how I know it. This is what it means. This is what we're going to do to support it. So it gave me that option to do that. You also have a little bit of darkness, kind of, this is called the inner canthus. It's the air between the bridge of your nose and the corner of your eye. This area deals with pancreas. You lean a little to the hypoglycemic side of the fence. It's at 10 in the morning, 2 in the afternoon, where you get that kind of tired feeling. If you miss a meal, you can get kind of cranky, and it'll affect your thinking. You won't
Well, I
feel like
used to really bad. I control it well through diet
sure,
now, but
because it's a
historically I had
lifestyle,
that
isn't
very bad. Yeah, and then I've also had pancreatic insufficiency
it?
in the past as well. So I don't know if that's also related to what you're talking about.
It would be anything with the pancreas.
Yeah.
It's the earth element, spleen, pancreas, and stomach. And again, knowing the 5 elements was very beneficial. As I kind of go down your face, there's a little more distinct line on the left coming across from the inner corner of the eye out. If those are watching this, you can kind of see it a little bit. This is
Yeah.
it's a bit of kidney deficiency. Kidney governs bone, and this is definitely an inherited trait, by the way. If you look at your family tree, there's probably arthritis and that kind of stuff. But kidney governs bone, and other symptoms: low back pain, joint pain, frequent urination, nighttime urination, scanty urine, menstrual problems, prostate problems, fertility issues. All those things can come into play. Because the line is more dramatic on the left side, this is an adrenal line. And again, the right side of our face is what we show to the world. It's our public persona. It's our mother's influence. The left side is our truer inner private self and our father's influence. So when you see a marker on one side, there's a gender specificity to it. So this adrenal line being a little deeper on your left side indicates you've had your fair share of stress that was caused by a male. And I'm
Uh-huh.
just here, so you can take that data
Yeah.
and use it. So
Maybe multiple, right? Yeah.
yeah, sadly, and
Yeah.
very sadly, it is so common to see this in females. It's disturbing, and I'm not
Yeah.
happy about that as a male. I look,
Yeah.
love the word love. I think it's a missing part. How much love did we see in this last 4 months coming off the TV? Everybody's bitching about the other guy and the other girl, and it was like, this is toxic, And I physically believe Harris lost because her message was, let's hate Trump, and people get too sad, you know. But and Trump's not a likable guy, Yeah, I would like to put a shot collar on him, just shut up, and yet he was never anything different. But he had a different pitch. Let's help America be great again. There was no way she was going to win using that kind of energy, and they're still using that
I
kind of
see.
energy. I'll watch the news, but I could watch the news in October of 2020. I used to go to bed cranky, wake up cranky, and when they had that I got to quit doing this. I got to
Yeah,
watch
just
this.
stop. Yeah.
And so I wake up happy. What a great idea. So, but I want,
I have actually one quick question about the right and the left
yeah,
with the mother and the father, because in other traditions I have heard they talk about the right side being the more masculine side and the left
right.
side being the more feminine side.
They're
Um,
both,
do you,
yeah, they're both right.
they're both
Here's
okay.
the right side of your brain controls the left side of your body.
I
So
see.
depending on
Yes.
where you're standing, that can be the case. I'm telling
Right.
you, in after 45 years of doing this, the right side visually is going to be the female, and the left side
See.
is going to be
Right.
the male. And it's so repeatable. I will see it. But
Yeah.
again, if you're standing from the inside of the brain, yes, the right side controls the left, and
That
that's where
makes a lot of sense. Okay.
the
Yeah, that
confusion
totally
comes
clears that up. I had a
in.
feeling there was a nuance there I wasn't picking up on. Yeah.
Yep, absolutely. So, it's fascinating. And you know, I was very much into energy medicine because I did acupuncture. There's, they talk about the chi and the flow of chi and this life force and this kind of stuff. The mentor that brought me to St. Louis, a guy named Ted Morter, he developed a technique called BEST. It stands for Bioenergetic Synchronization Technique. So I was very much into energy medicine. And as I began studying that world, it became fascinating. And science has done a lot that they've kept secret. And I don't know why they kept it secret, but everything has a vibration rate. Every word has a vibrational rate. The vibrational rate of the word love is 528. It's 528 hertz. And and what I did every day to every patient is I put them energetically in the state of 528. Nobody stayed there because you can't. It's a Christ-like energy. I'm sure Gandhi lived it, and some of the great minds in this world, they were very 528. And again, it's very hard to stay there because lots of things that pull us away. But here's the interesting thing: the word hate and the word fear both have a vibration rate around 100. Where this becomes significant is each disease has its own vibration rate. Cancer, there's nothing wrong with cancer. It just has a vibrational rate that's very detrimental to us as humans. But it just wants to live like you and I want to live. So depending on the cancer, it has a vibration rate of 40 to 100 hertz. So if you spend your life with hate and anger and fear, you're bringing your body down to a place that cancer says, "Hey, I can live here. Nobody's going to bug me. I'm at home." And it was when I came across this, I'm getting chills, like my hair is standing up on my arms right now. Even talking about it, it was this. Oh my goodness, I have to change the way I'm thinking. I had a moment. I love the word moment. It is the word that indicates the shortest time period. It's not millisecond. It's not nanosecond. It's not microsecond. It's a moment. That is the shortest period of time. But I had a moment. I aged, and I played competitive sports and basketball into my 50s. And now I have severe arthritis. I don't feel as bad as my spine looks, but it looks pretty bad. I don't have a disc at L5S1, totally collapsed, and severe arthritis all over the place. I have spinal stenosis. So my ability to walk has now been compromised. I can walk some, but I walk a mile in the woods, I'm okay. If I walk 2 miles in the woods, I'm in trouble because 2 miles is my limit. I can do 4 miles and I'm in serious trouble. I still bike, I still do weight training and that kind of stuff. But I was very angry at God for him allowing my body to go to crap on me. And I was very frustrated and I was getting into the thing. And Linda rolled over in bed. She was asleep, and her hand came and touched my arm. And she was still asleep. And I felt the most incredible 528 energy coming off of her in a sleeping state. And I thought, stop it, Dr. Todd. You have a wonderful brain. You have a wonderful marriage. I got a dog sitting right here that loves me. 4.5 of my 5 kids are great, and a half just from kid to kid. And I just realized I have to be thankful. We have to respect all the wonderful things that come my way. So I can't hike like I used to. Is that the end of the world? Not at all. It was that moment in your life where you go, I have to be grateful, and it was a life changer. Even though I'm still kind of cranky, I can't hike, but I can't bend over and I can't squat and all those things because my legs are weak from spinal stenosis. But my brain is sharp, and I your name again was? Sorry, getting off the joke. Uh, but I just, I love those moments, and I look forward to those moments. I look forward to information. I don't need to be affirmed.
Yeah.
I don't have to watch a certain news program because it affirms my belief system. If I'm conservative, I'm not going to watch MSNBC. I'm going to watch Fox. I don't watch any of them, but and vice versa. So
Right.
because it affirms my belief system, how about
Yes.
some information, stretching a little bit and
Yeah.
understanding someone's point of view. I always tell my staff, don't judge people when they walk through the door. They're in pain, they get uncomfortable, and they don't know. A lot of times they don't have an answer. They're afraid. Don't judge them. Now, if they're still a jerk after we've helped them, then they're a jerk. But then you can then judge. You're judging viciously. But it was very important not to judge people when you first meet them because they all got a story. You got a story. I got a story. It made us who we are. What we did with our story is the key. And the challenges in life, it's like stress. We're never going to not have stress. The bigger question is, do you adapt or do you maladapt to stress? And how you maladapt can manifest itself in lots of different ways. I know a whole
Yeah.
12-hour course on adrenal insufficiency and what you have to do to cope with stress because we're not going to be able to get away from it. And the one stress
Yes.
I don't care if you're a blade of grass, a human, or a sequoia, we're all going to eventually surrender to gravity. The blade of
Yes.
grass is going to surrender every year. We're going to surrender at 80 to 100 years. The sequoia is going to surrender at 400 years. But we're all going to surrender to gravity. So it's the one stress that will always be. There's nothing wrong with stress. It's do you adapt or you maladapt.
Yes. Yes, absolutely. And I think it's so beautiful how you've come to this field with such an open mind and it's led you to all these places where you've been able to really help people because you can still be discerning, right? And I think there's just a lot of fear that people have around so-called like pseudoscience or whatever, and I
Sure.
think sometimes it makes people not open to processes that work. And we might not always know exactly why or how they work, but we can't deny our clinical experience. And I just love that uh you've just allowed your practice to grow naturally according to like trying things and seeing what actually seems to make a difference in people's lives. Um yeah.
It's been an amazing run. And Jen, my successes clinically were so above your ability. I could
Yeah.
you're up right now thinking of case after case. And I go, how did that
Yeah.
happen? It has to do, I had the same dream, same voice, another dream. It was about intention versus attention. I'm an incredibly attention.
Mm.
I have young doctors call me in the clinic and they go, and they've worked with me and done the things I do. And they say, well, I'm telling you the things I do. I mean, the same thing. It seems patients that do the same thing. I don't have the same success. I would say, you don't have the same intention. And I would say to them, what are you
Yes.
paying attention to? What you pay attention to will drive your intention. My intention was to help sick people get well. We, as a staff, we prayed every day. If we staff prayed for me for knowledge or patients for understanding. And then we had these miracles happen. I can't explain. I mean, if I wrote a book about all the success I've had, the medical community would turn because it makes me not believe it happened, and yet it did.
Yeah.
It was
Well,
it
they're
just
feeling that energy. I mean, the energy you mentioned about just feeling your wife's hand and like that love energy coming in. I think this is a huge thing that's lost in the conventional medical field is that it's sterile and it's clinical and it's based on results that were done to mice in laboratories and it's completely divorced from any real relationship or experience with each other. And so if you're setting that intention, like I'm going to live my life in a certain way and I'm going to bring that into the office and into my interactions, people feel different after they've been
absolutely.
around you, right?
I have a
Yeah.
medical, I have a medical friend, and he showed me this thing that he got from Medicare, advising doctors not to touch their patients.
Yeah. Right.
You know, I mean,
Yeah.
really, uh, this would make we all touch each other, if not necessarily physically, but certainly energetically.
Sure.
You know, and we
Yeah.
we talk about the human aura, which a lot of information has been out about that for years. And then let's go back to COVID. What was one thing they wanted us to do? Obviously, wear these silly ass masks, but they wanted us how far apart? 6 feet. The human
Yeah.
aura. can be measured. And it's the energy that picks up other people's energy, this glow around us. It's how we choose a mate. It's how we choose a friend. It's how we choose someone we don't want to be friends with. And they measured it. You know, they measured the Dalai Lamas at 29 feet. I find that just fascinating.
Wow.
The average human, it's about 3 to 4.5 feet.
Mm,
And then they ask, how long do they want us? How far do they want us apart? 6 feet.
mm,
Talk about intentional. That is easy.
yeah, we can't feel each other anymore. Yeah.
Yeah, you couldn't pick it up. I just look. There's evil in this world, but our job is to. If hate is 100, our answer to hate is to love, because we knock out 5 of these haters. It's me. The path has always been me. We can win decisively simply by loving our fellow man. They
Yeah.
hate us. We can knock out 5 of them. We get enough people loving. We eliminate hate in this world. Would be nice,
Yeah.
wouldn't it?
Well, and I have to wonder if some of the reason this face analysis works is that humans are inherently such social connective animals, right? Like we come towards each other like full front, in a way that other animals don't. And so we're sharing so much like intention and information about ourselves, spiritually and emotionally and psychologically, but then physiologically too. Like we're sharing information with each other all the time just
Right.
by looking at each other in the face. All right. Well, I think we're getting towards the end of our
Oh,
time.
God,
So
Ann, this is a bad idea to end. This is way too much fun.
yes, I know. I know it could keep going on for a long time. But I hope that you can pitch your book and your homeopathic line one more time, and anything it's that you want people to find you out online.
Sure. Sure. You can find me, drtoddfrisch.com. Why the Face, go to whytheface.com, shapereclaim.com. Lots of things we can hook you up with. I just want everybody to know what I know. Well, I don't have to win a
Yes.
pissing contest anymore. When you're young, you got to win the pissing contest. Not at my age. I'm going to hit 72 here in a month, and I just I want to change the world to a better place. I'll do what I can do. Can I can I change it? Yeah, I think we can.
Yeah.
And just
Yeah, and you have so much knowledge you've accumulated, so much experience. I mean, I'm really glad that people are going to get more of your knowledge. So I'm definitely going to share those links in the video. And thank you so much again for taking the time.
thank you. So appreciate it. Appreciate it.
All right.